For those that may not know me, my name is Breck Rice. I am the co-founder of ServeRx. I started that company about a little over 10 years ago, but I've been working with community pharmacies for over 20 years, about 22 years now, and absolutely love the industry and will do everything I can to help community pharmacists. And I've really pay attention to services that will bypass the PBMs, so bypass the pharmacy benefit managers, so that the pharmacies can get the fair reimbursements that they deserve, and that's what ServeRx is. We're a claim processor, a third-party payer. We bypass the PBMs to give pharmacies fair reimbursements. When when I left the original company that was founded called over 25 years ago, I started in 2003. It was a wonderful program. Every pharmacy in the country used it. It was called Third Party Solutions, or TPS. But I had to leave because they sold to United Healthcare. And you can see here United Healthcare owns Optum, and Optum um, to community pharmacies is a four-letter word. And so I couldn't stay on and work for the devil, and so I left. And when I left, they filed a TRO, or temporary restraining order, against me, basically a gag order to keep me silent so that I wouldn't tell pharmacies that, hey, remember those 50, 60, $70 reimbursements you used to get? Well, now they're going to be like $2 or $3, because that's exactly what they did to those claims. So that's when I got involved in legislative work, and I also then host the PBM Reform podcast on the Pharmacy Podcast Network. But this slide just shows how the PBMs have aligned with the major payers, and their sole focus is to put independent pharmacies and our community pharmacies out of business. And so I wanted to do something about that. So what we're going to cover today is this is the mini community pharmacy roundtable. So we're not going to get into a lot of the products that I do on my full hour podcast once a month, where we invite vendors in like BioLite and Breath Rocks and other really cool, innovative products. We're going to focus today on clinical services. And there's a three-step process for being successful with clinical services. The step one is with seniors home services. I usually turn this over to George to talk about, but that's the remote therapeutic monitoring that that seniors home services offers through their remote care today. And I'll show you some really great explainer videos on that program. Phase two is when a pharmacy has gotten their feet in the door, doing some clinical services through remote therapeutic monitoring. Then they can take it a step further and get credentialed through the Independent Pharmacy Provider Network, which is the fastest fastest growing collaboration in the entire country between doctors and pharmacies. So already in 16, 17 states now, working with a couple of hundred pharmacies. So I can touch on that in just a minute. And then step three is, if your pharmacy has the room for it, you can do a full brick and mortar clinic. That program is called Brim Wellness. And what's unique and fantastic about Brim is not only is it a turnkey clinic that your pharmacy owns, but they'll even manage it and staff it for you. So they have a talent exchange program, so that you only have to have a nurse or a physician assistant or a medical assistant there when you have patients to be seen. So that way you're not having to pay somebody full time to manage that clinic. It's kind of like Uber for medical providers. So it's a great little program. So let me focus first on the remote care today by Seniors Home Services, which is the remote therapeutic monitoring, because this is a wonderful program for pharmacies, because there's zero startup costs. The pharmacy can get involved in helping all their seniors. So this works for both Medicare Part B and also the Advantage plans. This will help your seniors with the two main things that they are worried about. Loss of memory is the number one thing. I can attest that as a pre-senior myself, I worry about loss of memory, and so I certainly am very interested in the support and programs that remote therapeutic monitoring can do for my own memory. And then the other thing that all seniors worry about is the loss of balance or not being able to stand or walk without the assistance. And the remote therapeutic monitoring programs that seniors home services have work with, you know, providing solutions for both of those main things. So, I want to show you a quick little explainer video here about why this is so important for community pharmacies.
It's no secret that pharmacies are under financial stress today and need to find new sources of revenue within their existing businesses. Seniors Home Services is happy to introduce you to our Remote Care Today program that can provide tremendous benefits to your customers and new revenue for your pharmacy. Our remote care service is clinically proven, done over tablet or smartphone, and a Medicare reimbursable program that can help prevent, treat, and often reverse chronic illness, musculoskeletal disorders, memory loss, cognitive regression, and loss of balance, thereby slowing decline while helping prevent falls and loss of independence. Our remote care services are backed by years of success in improving patients' quality of life, helping them remain independent for as long as possible. You can make these services available to your patients as we provide a turnkey solution, including patient engagement, enrollment, support, and Medicare billing under our Medicare NPI. Our patient engagement process is easy and fun with our complimentary Turn Your Selfie into a Healthy app and does not require any additional work for you or your staff. This biometric facial scanning app, which we personalize to your pharmacy, uses smartphone facial scans to read blood pressure, heart rate, oxygen levels, and risk factors with incredible accuracy, engaging patients in their own health by knowing their numbers anytime, anywhere. We also provide posters and bag stuffers with QR codes. As people use the app and receive results, they naturally engage with our support team and learn all about how our services can improve their quality of life. Information on your patient's monthly progress will be available in our secure portal. And if you choose to review their assessments each month, you can earn administrative services fees for the time you spend, all while helping your patients live better and longer.
So that's the whole reason why we are partnering with pharmacies to help them. And there are three different buckets of help that seniors home services can provide for our pharmacy partners. What we're going to focus on today is the remote therapeutic monitoring, the RTM, but you can also help out with the remote physiological monitoring, or we just call it remote patient monitoring, and then chronic care management, or CCM. What is unique about working with seniors home services is that not one provider can do all three of those and bill Medicare for them. And so, what Seniors Home Services does is they collaborate with multiple providers so that you can do all three functions with your seniors, and it's not a conflict. So, one vendor could do CCM and RPM, or CCM and RTM, but they can't do all three. So it's great that Seniors Home Services collaborates with multiple providers to be able to have a more broader range of solutions to help our seniors. So this is what the seniors get out of the program. So let me just show you this.
Remote Therapeutic Monitoring, RTM, is a clinically proven and Medicare reimbursable program that not only
Oh, we lose the sound. There we go.
Remote Therapeutic Monitoring, RTM, is a clinically proven and Medicare reimbursable program that not only helps recovery from accidents, but can be directed to help prevent and often reverse memory loss, cognitive regression, and loss of balance, thereby slowing decline and helping prevent falls, as well as helping with stress, anxiety, working memory, concentration, decision making, and emotional control. In addition to the physical improvements patients can see, these programs can improve plasticity, which will improve patients' quality of life, helping them to remain independent for as long as possible. We are pleased to make RTM available to your patients and make it so easy as we provide a turnkey solution. including patient support and Medicare billing under our Medicare NPI. Introducing RTM to your patients is easy as we do the entire introduction and education for them. We'll send them a landing page, which can include a short video message from you, as well as educational videos, and then give them the opportunity to enroll right there. We'll also reach out by phone to assist with the enrollment process. When they enroll, our coaches personally call by phone to welcome them and send a welcome email with logins to their personal customized programs. Their personal coaches are available by phone as needed to help them along the way. As with all our programs, we take care of all patient support, coaching, encouragement, and all billing. Remote therapeutic monitoring can have a major positive impact on your patients without creating any additional work for you or your staff. Just click the Get Started button on this page to begin.
So the program that Seniors Home Services is going to start with is Brain Savers. They're going to have multiple uh, programs for seniors, but this is the one that we'll start with. And there's a link there that shows a demo on some of the practices that you would do and some of the brain games that patients would do in order to help with what the video talked about, the brain's plasticity. And then there's also exercises. And basically, to be eligible for this program, the patient needs to be active basically every other day. So it's 16 times per month, a 10-minute exercise or brain game in order to be covered by Medicare and the Advantage plans. And like it mentioned, all the things that it's going to help with is memory, your recall, response times, and you can see a list of all of the things here that seniors are challenged with, and how this program helps. Now, if the pharmacies who start enrolling their patients on this will get paid an administrative fee if they want to, and I highly suggest it, right? Because it doesn't take a lot of time. It's literally a 30 to 45-second review of the patient's progress. Make some notes if needed, and then click a button. So this video here shows you, what your responsibility is as a pharmacist.
Working with our program is easy for you and your staff. If you choose to review your patient's monthly progress and earn administrative services fees, you will be sent a weekly email notification reminding you to log into your portal and review patient assessments. You or an appropriate member of your staff will review these reports, review the summary data for the patient, add your notes, and then simply click the sign-off box next to the record. It's that easy, and it's that fast.
Yeah, so it really is just that simple. Literally takes about 30 seconds. But even if it took you an entire minute per patient to review, I did the math on that. And if you had 100 patients participating in the program, you're going to get reimbursed for your administrative fee, $25 per patient per month. So that's $2,500 per month with just 100 patients, and that would take around 2 hours. So paying yourself over $1,200 an hour, it's pretty good return on your time investment there. Seniors Home Services is going to provide all of the marketing materials that are needed, including helping our pharmacies do the little welcome video. It's great when it's coming from you or whoever the face of your pharmacy might be, one of your techs that's really upfront and all of your patients know really well. They might be the one that you do the little introduction video with. But we can certainly help you through that whole process. It's completely turnkey. And then wanted to also show this video example here of what's called Selfie to Healthy. It's basically just a facial scan that can give you some biometrics that are absolutely amazing. And so patients are going to love this, but by getting those biometrics back, we'll actually be able to identify certain chronic conditions they may be dealing with so that we can support them. So let me show you this little explainer video.
In today's healthcare environment, one of the biggest challenges for medical providers is engaging patients in proactive care. It's hard to convince someone they need help when they don't even recognize the signs. But what if there was a way to make the need clear without you having to be the one to do it? Meet a revolutionary solution for patient engagement: AI powered facial recognition. We call it Turn Your Selfie into a Healthy. Imagine a technology that helps your patients track their health, identify risks, and stay engaged in programs like our health and wellness coaching to keep on track with their health, all without you having to perform the assessments or having lengthy discussions with the patients. This advanced technology provides an easy to use, self guided experience for your patients. They can complete assessments from the comfort of their home, gathering valuable data on their own through a 30-second AI facial scan using their smartphone. With 96% accuracy and 98% repeatability, it can analyze metrics like heart rate, blood pressure, oxygen levels, health risks, and others. This is not a substitute for medical care, but it is an accurate way to identify symptoms that just might help your patient recognize the need for lifestyle changes and to make healthier choices with diet and exercise. In addition to the immediate on-screen results, a detailed report is also generated, which we will review with the patient and educate them on how our remote care services can be so helpful. It could also encourage them to become more engaged with our proactive cognitive improvement program, designed to improve both memory and balance. We provide marketing materials like posters and countertop materials. As people use the app and receive results, they eagerly engage with our support team and learn all about how our services can improve their quality of life. This isn't just about making your job easier, it's about empowering your patients and improving outcomes. So, what's next? Speak with your care consultant today to learn how you can enroll in the program and start offering our remote care services to your patients, all with no upfront costs. Together, let's make proactive health easier for both you and your patients.
So when George brought this opportunity to my attention, it was absolutely, perfect for me because I had been wanting to help community pharmacies for quite a while. And the reason why I do my more profit roundtable monthly was to bring in solutions. But there's zero startup costs. There's no cost for our community pharmacies. In fact, that selfie to healthy application will be it's free to the pharmacies. Pharmacies will have that, be able to utilize it, and there's no cost to it. So it's absolutely amazing program. Let me just do a one last review of the pharmacy program here for you. Oops, keep playing.
Process is simple. First, we'll create your co-branded Turn Your Selfie into a Healthy app and provide a customized poster and bag stuffers for your pharmacy. Your patients see our materials, scan the QR code, and are taken right to your selfie app without any downloading required. They fill out a simple opt-in form, followed by taking their own selfies. Within seconds after taking their selfies, the patient receives their scan results, along with information about our remote care programs, and are encouraged to contact us to learn more about their results, as well as about our paid-for by Medicare health and wellness programs that also improve balance, memory, and quality of life. To get started, your next steps are easy. First, complete our agreement and sign the BAA, which ensures HIPAA compliance, and then we'll schedule your onboarding meeting. During this meeting, we'll discuss how we engage patients and the materials we can print and provide you that help patients engage with us. We will then educate and onboard your patients using approved text messages, emails, and friendly phone calls, providing the patient the appropriate programs and coaching, all without any cost to you. Your pharmacy then has the option to provide monthly data reviews for each patient, which earns you monthly administrative service fees. Better patient health, new revenue for your pharmacy, improved patient loyalty. Let's get started.
Okay, because you'll be under the business associate agreement, you then can provide or run a bin analysis out of your pharmacy system and actually identify all of your seniors patients. And Seniors Home Services will actually help market this program. So you can get them from two angles. They'll see the information there at the pharmacy. Your text can explain the wonderful benefits of the program. But then Seniors Home Services will also reach out to them with text messaging, email if you've got it. I know a lot of pharmacies usually just have the phone number for text reminders, but they'll even call them as well to invite them to participate. And just to recap, it's $25 per month per patient who enrolls. So if you've got 100 patients on it, 2,500 a month residual. Uh, 200 patients is going to be 5,000. So it's a wonderful, wonderful program. So step two is getting your pharmacy completely credentialed to be a clinic and take advantage of incident to billing. And that is through the Independent Pharmacy Provider Network. I'm just going to touch on this really high level because if this is something you're interested in, you'll want to schedule a separate demo specifically for this. But the four pillars are the pillars of success for IPPN. These are also the same things that will pharmacies will fail at. And I've unfortunately seen a lot of my pharmacy partners try to get credentialed, try to get into the medical networks, and spend thousands and thousands of dollars and still not get across the finish line. And so that's why I reached out and did some investigation to find a program that could help our community pharmacies. And this is it. It's the Independent Pharmacy Provider Network. They provide a turnkey software solution that is very user friendly. You'll be able to see that on the demo. They do the collaborative or CPA agreements. They have them for all 50 states. You will need a doctor that will collaborate with you. And the difference here between this program and the retail clinics you saw with like Village clinics and minute clinics, at the big chain stores, this is not taking the attribution away from the doctors like those clinics do. This is partnering with the doctors and working together to create a better community care solution. Then after the CPA, the third pillar is they actually help recruit those providers for you. Now, it's always great if you have your own relationships because that's easy to go to those doctors you already know and work with, but they'll actually help you recruit and bring on additional providers. And then they do all of the the payer contracting for you to get you into the networks that you need to get into, starting with Medicare. So helping you get your PTAN and set up not a pharmacy PTAN or credentialing. This is a clinical. So you're literally going to have a new clinical NPI. And this helps you bypass the PBMs so that you can turn things like a flu shot that you're only getting reimbursed $20 on. It will actually turn into like an $85 well care visit. So they'll even do the billing and collecting for you. In fact, I highly recommend that you start um, with their billing team because they know what the modifiers are that are needed. One of my clients got all set up to do billing through another credentialing company and started billing, doing services. Has over $100,000 that he hasn't been able to collect on because the team that they were working with just didn't know, and not any fault of the pharmacy or the credentialing experts. They meant well, they wanted to do the right thing, they just didn't know how to do it. And so IPPN is now going in there to help them clean that up. So here's some examples, just some of the CPT codes that you'd use for preventative visits, office visits, and then later on even diagnosis for blood testing and other things like that as well. And then the final phase 3, is the Brim Wellness. That is the turnkey brick and mortar clinic that's completely managed. And like I said, it even has the talent exchange there for you. So you don't have to pay for an FTE or have to split your time as the pharmacist between your pharmacy and the clinic. You can have a medical professional that's there on site taking care of your patients for you. And then the third leg of this stool is pretty interesting. I really like this. It's a financial um, vehicle for your pharmacy. So not only will it help you do the build out if you need to put up 3 or 4 walls and bring in a hand washing station and all of that for you. The footprint's about a 10 by 12 footprint that you'll need. Um, but this financial credit will actually help you, finance that build out. but then you can contribute to it to help the next community pharmacy get set up and build out their clinic. And then it's another revenue stream for your pharmacy because you'll be earning a really nice like 8% on your money. And I don't know of any bank or credit union that's willing to give you, uh, more than 0.02% right now, it seems like. So that's just becomes another financial vehicle for you, or another profit stream uh, for your pharmacy. So just to recap, we want to start with seniors home services for our community pharmacies because that's the easiest way to get started in making some pure profit with no startup costs. But then you can apply some of that pure profit to getting credentialed and set up. And that's a whole separate demo that we can show you, but it's less than half of what the cost for getting set up is as any of the other credentialing companies out there. So it's literally like three months of your revenue or profit. Sorry, not revenue. It's pure profit that would come in from seniors home services would actually uh, pay for the credentialing. So want to finish it up and open it up for any questions. Let's start first with our pharmacy partners that are here. We want to make sure we address any questions that our pharmacists have first, but then certainly can make myself available for any of the consultants. If you do have any questions and want to get started in your pharmacy, just get with the care consultant that brought you today, and they can help you get the agreement out so you can get your BAA signed and get started. So thank you for your time, and I'll open it up for any questions.